Good afternoon, everyone. I'm Chris Brodie. I'm the General Counsel for the Local Government Board. I am also a new guy. I was a new guy before Jason came on board, so unfortunately he took that title away from me. But I see how they treat new guys with this time slot after lunch. So next year, game on for that 10 o'clock time slot. There's going to be a bidding war. Okay, well, we'll see what we can do. So as you can see, we're going to do something a little different this year. We're going to have a conversation between ourselves and hopefully have some time for questions at the end. If you like it, please let us know. If you don't like it, be kind, and it was David's idea. All right?
And I'm working on Dolly, so I've got a little work to do.
All right, so as I mentioned, I'm Chris Brodie. I started in April of this year. Prior to that, I worked for 10 years with the state. I worked 5 years with the State Employees Insurance Board, and then I had 5 years with the Medicaid agency. And so came over in April, really excited to be a part of the team, and I'm really honored to be on the panel today with Ms. Scroggins, somebody who does not need any introduction. Well, Teressa constantly amazes me every day. Just the other day we were talking, and I said, Teressa, why don't we do this? Why don't we do something different? She always says, well, you remember C35 had this issue, or M50 had this issue. And I'm like, how in the world do you remember these things? But she's amazing. She has an incredible historical knowledge, and I'm very happy to be here. So Teressa, tell us a little bit about yourself.
I'm Teressa Scroggins, Program Manager of Local Government Enrollments. In March, I'll be there 29 years. So retirement in the near future? No, I'm just kidding. And I know everybody in our office is like, what? And I'm glad to be here today and talk with Chris Brodie and see if we can answer some questions.
And I've put Teressa at ease. It's always dangerous when you allow an attorney to ask questions all day, but I've told her it's not going to be painful. I promise you. All right, so we're going to start at the very beginning and walk through the enrollment process and all the eligibility rules. So Teressa, let's go through, what is a full-time employee?
A full-time employee is an employee who receives a W-2 and is an employer-employee relationship, and they work a minimum of 30 hours every week.
All right, but what if I'm a unit who classifies a full-time employee or a part-time employee as someone who works, or a full-time employee, 35 hours or more?
Regardless if you classify them as full-time or part-time, what we're looking at is the number of hours that they work each week. So if they're averaging 30 hours, then they should be offered health insurance.
Okay, so for insurance purposes, that's the mark, 30 hours.
For insurance purposes.
Okay. All right, so one issue that comes up, and this issue is going to get me in trouble with my profession, so I'm going to go ahead and acknowledge that now, but one issue that comes up a lot of times is attorneys. All right, city attorneys. John Smith's got a law practice down on Main Street. John's a fine attorney. I'm not talking bad about John. John does criminal, civil work all day long, but he also happens to be the city attorney. Unless John is in an employer-employee relationship and he works 30 hours or more and he's a W-2 employee, he's not eligible for coverage. It also happens in the municipal judge context. John's got his law practice. He does traffic court at night as a municipal judge. Again, if he's not working 30 hours or more a week and he's not in that employer-employee relationship receiving a W-2, he would not be eligible for coverage. And we've seen that come up quite often during the audit. So go ahead and throw that out there. And then, unfortunately, I've also have to talk about ACA. Don't worry. I'm not going to go through every minute detail of measurement periods and stipulation periods like my predecessor, but he's here. So if you want to know anything about that, David's in the back of the room. What I do want to know is how many of you have 50 or more full-time employees? Raise your hand, please. All right. Those of you who are raising your hand, here's why ACA is important. Under our rules, the local government rules, and there's a laundry list, so hang with me, temporary, part-time, seasonal, intermittent, or emergency employees are not eligible. However, if you raise your hand and you have somebody in that category and they work 30 hours or more per week or 130 hours per month, they could be eligible. So you need to know that. Talk with your legal counsel, talk with your HR people, make sure everybody's on the same page and that you would know they would be eligible under ACA. Next thing we're going to talk about is elected officials. How many of you cover elected officials? All right. Teressa, how do we define an elected official?
An elected official is Individual elected to public office by the vote of the people at the state, county, or municipal level of government.
And is the key to that the vote of the people?
The vote of the people. For an example, an elected official would be a probate judge, sheriff, mayor, city council member, could be the revenue commissioner or a commissioner. Those would be examples of elected officials.
And what kind of issues do you see regarding elected officials? What type of scenarios pop up that people have questions about?
Most time people have questions on board members. They see them as elected by the water board. I'll use that as an example. On a water board, they say, well, they're elected from our customers. Well, those are not elected officials. We're looking more on the probate judge, mayor, those type elected officials.
Okay, what if I'm a sheriff? We had a sheriff who retired, and then we had another sheriff who was appointed to fill his term. What would happen in that scenario?
He would be eligible for coverage if your unit allows elected officials because he is filling an elected position even though he's appointed.
Okay, so we look at the position and not the facts of each case like that.
Correct.
Okay. All right, so we know who our two people are who are eligible. Let's talk about the enrollment process.
On employees who are eligible that work a minimum of 30 hours a week, they would need to enroll or decline with acceptable proof of other coverage. We get a lot of calls on what is acceptable proof of other coverage. It's going to be a letter stating the person is currently covered with a current date. It could be a certificate of prior coverage, a certificate of current coverage. It could be Medicare card, a letter from the employer or the insurance company, or if it's a military ID, a copy of the front and the back of military ID.
All right, now what's not acceptable?
Not acceptable would be an insurance card, because that insurance could have canceled last year, the year before, or who knows where you got the insurance card from. It could be explanation of benefits where a person's been to the doctor, or it could be a pay stub showing insurance was taken out. We don't know what insurance was taken out of the person's check.
All right, so we know we've got our eligible employees, we've got our elected officials. They've got to either enroll and decline and provide proof of other coverage. When they do enroll, what are our options for their effective dates?
The unit can choose date of hire or first day of second month. An example would be if they were hired in August, then it would be October 1st. Subject to the probationary period as long as it has been approved by the local government board.
Okay, and that's the key, right? You can have a probationary period, but we need to know about it. Otherwise, we have no idea what your time period is. All right, so we know we've got our employee, we know they have to enroll or decline. What if they want to add dependents? Let's talk about eligible dependents.
An eligible dependent, a spouse, could be a child under age 26, could be a child that's been adopted by the subscriber, which is the eligible participant, or their spouse. It could be a stepchild, a grandchild, niece, or nephew, as long as there's legal custody, and they're under age 19. That was the key there, is under age 19, or an incapacitated child who meets certain criteria that's over age 25.
All right, so now we've talked about who's eligible. Let's go through who's ineligible. And I think the easy answer to that is anybody who fits into a category that we didn't just talk about. But the three that come up most often, what are those?
It's going to be a dependent that's eligible for coverage in the local government program, because they could work for the same unit or another unit participating with local government. An ex-spouse, even though the divorce decree says they must be covered, they're not allowed to be covered as a regular dependent. They may be eligible for Cobra. And when you take off an ex-spouse, that includes ex-stepchildren also, regardless of what the decree says.
Right, we do see that from time to time where a judge will order coverage for an ex-spouse, but under our plan, they're not covered. This year in the admin guide, we're going to have a section of ineligible dependents. It's not an exhaustive list. Obviously, there's always going to be an example that we didn't think of, but it's up basically, if they're not eligible, they're ineligible. Think of it that way. All right. Now
And
let's
you know
talk.
that was the attorney coming out.
That's right. And I skipped that slide, but there it is. So it's in your book. All right, so we know who's eligible, who's ineligible. How do we enroll a dependent?
You can enroll a dependent as a new employee. Also, if there's a loss of coverage. Loss of coverage would be if they lost their job, death, divorce, any of those qualifying events for a dependent. If they lose their other coverage, then they can enroll. Also, substantial change in the other acceptable insurance. The employer stopped contributing. If they elected Cobra, if they exhausted Cobra, then they could enroll due to loss of coverage.
All right, what if I wanted to add a new dependent?
You can add a new dependent as long as the local government board is notified within 60 days. You can add that new dependent.
All right, and we've got something up here called Tagalong rule. How many of you know what the Tagalong rule is? That's what I thought. Teresa, let's talk about Tagalong.
The tag-along rule would be, for an example, if someone has a new birth, we can add that new baby. We can also add other dependents, and the effective date would be the date of birth. As long as they have a qualifying event, we can add other dependents. For an example, if you lost your job and say your children were not on that other insurance, when they were added due to a qualifying event, you can add other dependents at that time.
So you could add your spouse at that time also.
You can add your spouse also with a new birth.
Okay. One other thing that comes up while enrolling new dependents from time to time is national medical support notices. It's very convoluted. The short answer is this is an order that's issued by the child support agency in the state. In Alabama, it's DHR. It's not a court order, it's not a divorce decree, but it's from the child support agency. And what it does is it orders coverage for a child. And so if one of the parents is on our plan, we'll get this and we'll have to place coverage. It's subject to the withholding guidelines. If you have an issue with the withholding guidelines, the unit would contact DHR to settle that and say, look, there's an income issue here. But the main thing is the child cannot be removed from coverage as long as that order is in place.
If you have an employee who has declined coverage, they're currently not on local government, if we receive a national medical support order, they're required to enroll. And if they don't have family coverage, they're also required to enroll at that time.
That's a good point. All right, so we've got everybody enrolled. We know that process. Now, if we want to cancel them, let's go over the cancellation policy.
If it's an employee, you can cancel due to death, termination, leave without pay, retirement. That would be a cancellation form. To cancel a dependent, it would be divorce, dependent got a job, the dependent's open enrollment, loss of custody, Medicare entitlement, Medicaid entitlement, whether they aged off, if they were a dependent turning 26, grandchild, niece, or nephew turning 19. All of those are qualifying events. But we've got a new change for January. The new change for January is going to be if they want to drop a dependent during the year, then it has to be a qualifying event. So that's new for next year.
Yeah, so I would make a note of this, write it down in your book, starting January 1, in order to drop a dependent, you've got to have a qualifying event during that calendar year. And if you had a cafeteria plan, those of you who have your insurance coverage pulled out pre-tax, that's always been the rule, but we're going to make that the rule for everybody starting January 1. And let's talk about divorces, because we get those quite often, right? So divorces, when you guys tell us about them, we try to get them keyed as timely as possible, but a lot of times we don't know about them. You may not know about them. So a couple years ago, we instituted a data match with the Department of Public Health, where we're getting monthly files from the Department of Public Health, and they'll tell us when a divorce occurred. And I'll go on the court system's website, pull the court order, because from time to time, there'll be one on there where they had a court order issued, and then maybe they remarried, or they decided, oh, we really didn't want to get divorced, and they'll ask the court to override the divorce decree. When we find out about those, what do we do, Teresa?
We Take the dependent off, then if they're eligible for Cobra, we send a Cobra notice, and then we notify the unit. That way you can have that for your ACA at the end of the year to know that dependent has been dropped off. Normally you'll get an email telling you a dependent is no longer eligible and they've been dropped off.
And if it's a retro cancel, we also have to go back and look at those claims to see if there were any claims during that time period. And if there were, we try to recall them. Recall them means take our money back, basically, take our money back from the provider. But unfortunately, there's certain claims that are not recallable. Pharmacy claims are not recallable, certain high dollar claims. And that time period takes about 60 to 90 days. We will put the member on notice that there are claims out there and that they could potentially be liable for those claims pending the recall process. And that's going to take, again, 60 to 90 days. At the end of that, we'll send them a letter letting them know how much they owe us. We'll work with them, depending on the dollar amount, maybe set up a payment plan. But that's the process for if there's claims on the retro side.
So you mean if we have a friendly divorce and, I mean, you really like the stepchildren and we can't keep them on?
Unfortunately, no.
Wow. We worked all those arrangements to be friendly and now we can't leave them on.
All right, so that's bad news, right? Recalling claims and member recoupment. Nobody really wants to do that. We don't want to have to do that. But let's talk about some good news, right? Cobra, okay? No, the good news is, seriously, ARP Cobra, we think is over, okay? We think it ended in October, barring some last-minute federal government change and where they're going to extend the deadline. We think it ended. What I will tell you is that people had 60 days, right, to elect coverage, so we're still within that 60-day window where some people could elect coverage. If they do that, we will follow the same process where we will send it to the unit to make the determination of whether or not they're eligible or ineligible, and we'll follow that same process. But hopefully, we're at the tail end of that. Let's talk about the normal Cobra process.
The normal Cobra for termination of employment for a participant is 18 months of Cobra. If it's a dependent due to death, divorce, is 36-month qualifying events. Normally when we receive the dependent cancel or the cancellation for the employee, we do several things with those forms. We actually go in and do the cancel. If there's any claims that need to be recalled, we recall those claims. And then if the units do a credit, then we'll give them a credit if they're due one, if there's no claims.
And on the billing, how do we handle the Cobra billing?
On the Cobra billing, on Cobra, they are billed to the participant's home address instead of the unit.
All right, one thing that was brought to our attention during ARP is that there are categories. There is a category of people who are ineligible for Cobra, and if you were terminated for gross misconduct. And so we added a box on our cancellation form to address that. So going forward, if you have somebody who's ineligible for Cobra because they were terminated for gross misconduct, please check that box. Because otherwise we have no idea and they're going to get Cobra paperwork from us, and then you may call us and say, well, they weren't eligible. We didn't know anything about it. So we're going to send the paperwork out unless it says gross misconduct on the cancellation form.
Well, being an attorney, can you give us a definition of gross misconduct? What is gross misconduct?
Unfortunately, no, I can't. And here's why. It's not a defined term. If you look into federal law, it's really not a defined term. What I can tell you is, I always say, I know it when I see it, right? You know gross misconduct when you see it. If it involves a felony of any kind, that's gross misconduct, okay? But I would just say consult your legal department, consult your attorneys, consult Joe Smith, who's not eligible for our plan. He'll let you know. All right, we have talked about all the things that occur during the year. What about this time period called open enrollment?
Open enrollment is November 1st through November 30th. It is not December 1st. We get a lot of calls on December 1st and say, is there any way I can get one more piece of paper in? The answer is no. Open enrollment ended.
All right, and what can an employee do during open enrollment?
An employee, if they previously declined, then they can enroll in the health insurance. They can, if they're currently enrolled, they can decline the insurance. They can add, drop dependents or family coverage without a qualifying event.
What's the key to the open enrollment time period as far as when is coverage effective?
Coverage is effective January 1st for open enrollment.
And do we need to know about that?
On the form, it needs to have a January 1 effective date, because if not, we're not sure what the person wants to do, or if they're wanting to possibly try to drop for December 1.
Yeah, so for example, if I have a baby November 15th, right, and I want to add that baby November 15th, unless we put November 15th or the effective date of coverage, and I submit that during open enrollment, our people don't know that. And so that's going to prevent a lot of back and forth with you guys. So if he wants to add the dependent January 1, make sure you put January 1 on that form. All right, so we talked about what employees can do. Units can also make changes during open enrollment. Units can change their effective date of coverage, the first day of the month or first day of hire or second day of first day of second month, whatever. You can change those things during open enrollment. One thing I do want to mention, though, another change, again, going forward, and make a note of this, we're going to try to make these, call out these changes as we go forward. Probationary periods. New units who come on board after January 1 of this year, and those of you who do not currently have a probationary period, we're going to do away with probationary periods going forward for insurance purposes, because just to simplify the process. Give you two options. You got date of hire or first day of second month. It just becomes overly complicated when you're trying to factor in probationary periods. But don't worry, if you're a current unit and you have a probationary period, you're okay. We're going to grandfather you in unless you make a change in the future. Then you're going to be subject to the new change and not be allowed to go back to a probationary period. But that's just something we decided to do administratively to make things simpler. Units can also add or drop coverage. So if you want to add elected official coverage, if you want to add retiree coverage, if you want to add Medicare coverage or dental coverage, you can do that during open enrollment.
Open enrollment the month of November for January 1st coverage.
All right. Joe just talked to you about Southland voluntary insurance, but we're going to expound on that a little bit. Teresa, tell us about Southland.
Southland voluntary coverage is vision and dental. You can enroll anytime during the year. A change is going to be for January 1. The effective date will be the first day of the next month. So if we get the form on January 29th, then they can add February 1st. So that is a change. Currently, it's first day of second month, but come January, be first day of the next month. Also, for Southland, they have 12 months minimum enrollment. That applies to the participant and also the dependents. So they have to be enrolled for 12 months, and then after the 12 months, they can cancel the open enrollment of the following year. For family coverage, we've got a change also for Southland. You can add dependents to existing coverage anytime, and it'll be effective the first day of the next month. So that is a change there for adding for Southland. Acquiring a new dependent is a change also. As long as we're notified within 60 days, then that change will be effective the date of the event. So that's a new change also. Currently, it's the first day of the next month, but acquiring a new dependent will be the date of the event as long as we're notified. Also, for Southland open enrollment, you can drop family coverage without a qualifying event as long as the 12-month rule has been met. You can cancel Southland as long as the 12 months has been met also.
And again, it's going to be very important that you put down the effective date that you want for those particular situations, right? If you're going to want to add them the first day of the next month, or if you want it effective the date of birth or the date of marriage, we need to know that on the form.
And that change is for January 1.
All right, now for the fun part. How many of you cover retirees? All right, several. Okay. I promise our rules are not as confusing as they look, and we're going to try to simplify them as best we can. the main thing from our perspective, and there's a lot of main things, but the main thing from my perspective is you've got to have an active employee who goes right into retirement. Every once in a while we'll see a situation where active employee terminated, but he's still eligible to draw his retiree benefits from his pension plan. That has no bearing on his insurance, right? I mean, he's got to go from active status to retiree status. So that's hurdle number one that they've got to cross. And then there's a couple of other scenarios. So walk us through those.
First of all, they have to be in the plan for 10 years. It does not have to be consecutive. I know we've got a new group here that's interested in joining. It's going to be a little different for a new group, or if you've been in the plan less than 10 years, they had to come on when the unit came on to be eligible to retire. But there's two types of retirement. Service retirement is 25 years or 10 years in age 60. And the one we get a lot of calls on is disability retirement. Before they do disability retirement, they need to apply for Social Security disability, and the key there is before they retire. They need to go ahead and apply for disability. Then
and let me jump in there. What about if I applied for disability through RSA? Would that count?
RSA would not count. It would have to be through Social Security. And then we would receive a cancellation, offer 18 months of Cobra while they're waiting to see if they're eligible under Social Security disability. If they're approved, we'll convert it to a not Medicare retiree, and then they have 24 months to get Medicare.
All right, let's walk through that. Okay, so we give them 18 months to get Social Security. What happens if at the end of 18 months they're unable to get Social Security?
Then after 18 months, Cobra will end, and that's the end of their benefits.
Okay. All right, but during that 18 months, I do get approved for Social Security, right? So I'm then converted to a non-Medicare retiree for 24 months.
Correct.
And I get that to allow me an opportunity to get Medicare. What if at the end of that 24 months, for whatever reason, I'm not able to get qualified for Medicare?
At the end of 24 months, then your coverage would end.
Okay. But if you do get Medicare, then it depends on whether your unit covers Medicare at that
Correct.
point.
If your unit covers Medicare retirees, then you would be changed from not Medicare to Medicare.
What about if your unit doesn't cover Medicare retirees?
If your unit does not cover Medicare retirees, then once you got Medicare or the 24 months, the coverage would end.
And in order for them to be enrolled, if your unit covers Medicare retirees, do they have to have Part A and Part B?
They need to have Part A and B. I know someone asked a question earlier about Medicare. As long as they're actively working, in most cases, they don't have to have Medicare. But once they retire or go on Cobra, they would need Part A and B. And once we receive the form, they would automatically be enrolled in United Healthcare.
And we need a copy of that Medicare card,
And we
right?
need a copy of the Medicare card.
All right, I know this slide looks, there's a lot of information on this slide, but we purposely did that because we felt like this is a good slide for you guys to use as a cheat sheet. Take this home, look at it, but it's got our main forms on here with a description of each form and the deadline. So let's talk through these forms, Teresa.
On the first one is Form LGO1. It's an enrollment form. You would enroll an employee. We need that immediately when you hire the employee. If it's an elected official, they need to enroll within 30 days of assuming office.
All right, and what about the declination form?
On a declination form, we need that as soon as possible, immediately. And we also need, we had talked about earlier, that acceptable proof of other coverage. So we would need the declination and proof of acceptable coverage.
And the status change form?
Status change form, they can change their name, address, date of birth. Also, if they need to change dependent information, email. Also, if they retire. But on your normal changes, we need them as soon as possible, especially if they're making a change of their address or dependents. If it's a retiree, we need that 30 days before the retirement date.
New dependent form?
A new dependent form, they can add dependents or add family coverage, and we need that within 60 days of the qualifying event.
And the cancellation form.
The cancellation form, we need that, especially if it's a divorce or dependents are not eligible. But on a dependent cancellation, you would drop dependents or drop family coverage. We need that within 60 days of the qualifying event.
And the last one is the cancellation form.
On the cancellation form is used if a subscriber or participant is no longer employed, they lose their eligibility for insurance, retires, and the unit does not cover retirees, leave without pay, military leave, or if they pass away. And we need those as quickly as possible to prevent any claims from being paid after they're no longer eligible.
So we've gone through the forms, we've gone through the eligibility process, who's eligible, who's not. How do I submit documentation to you?
The main thing is email. Our email address is enrollments@lghip.org. The keyword there, I talked to a girl the other day, and she says, I have sent this email 3 times, and it's not going through. She left off the S, so it's enrollments with an S, as I tell everybody. Don't send it to a particular person because, like myself, I'm out of the office today. It may sit there. I could be on vacation. So make sure it goes to enrollments, and whoever's in the office can work that paperwork. A lot of people don't like to hear about snail mail, but snail mail still works. Our P.O. Box is listed, P.O. Box 304-900, Montgomery. And then also we're encouraging everybody for new enrollments, declinations for new employees to use the online system.
All right, and that's it. We've got, I think, a few minutes for questions. What I would say is if you've got a personal question, feel free to talk to us off to the side so that we don't get into personal information here. But if you've got a question about our presentation, let us know. Now's your time. And if it's ACA related, David will handle it.
I just want to clarify on the Southland. So you can enroll in that any time during the year. You just have to maintain it for 12 months. During open enrollment, you only drop it if you have that 12 months.
That's correct. Her question was on Southland, you can enroll anytime during the year, but you must keep it 12 months, and then you can cancel the next open enrollment. Also, another change for January is currently we let them enroll throughout the year if they were not enrolled in Southland. A new change for January, say an example, somebody has Southland Vision, and if they wanted to add dental, they could do it the next open enrollment. But now we're going to start January 1. If you've got one or the other, you can enroll in the other one throughout the year. Yes, ma'am. Yes. Her question is, if somebody has single coverage and they're wanting to add a baby, is the baby covered for a certain length of time? Unfortunately not. When we receive the paperwork, they would add family and it would be effective the date of birth as long as we were notified within 60 days. A lot of times on a new baby, a lot of those charges are under the mother if it's a well baby. So the baby may not be incurring their own claims. So great question. Yes, ma'am. Okay. Her question is, if you have Southland and you leave employment, can you take it with you under Cobra? like you can your health insurance, yes, you can. You are offered the same Cobra 18 months if it's termination, and then they would be billed at their home address. See any more questions? Yes, ma'am. Her question is, she has family coverage, her son is on her insurance, he comes to work, same unit, does he have to get single coverage? The answer is yes, because he is eligible to be a participant in the plan, so he would come off your insurance and enroll in single coverage.
And a follow-up to that is, even if he went to work for another unit, right, as long as that unit participates in our plan, he would have to come off your coverage and get his own single coverage.
Any more questions? If you have personal questions, please catch us, and we'll be glad to answer any questions that we can.